most of the time in situations when someone is unconscious or someone has collapsed, it's a chaos. So the first thing that needs to be done in this situation where everyone is panicking and everyone has a remedy and everyone wants something to do, what you have to do first is you have to be a leader. You have to take charge of the situation and you have to instruct people what to do, give instructions like you do this, you do that, you do that, do that, and then you have to organize, because that is what will save lives. Everyone pitching in and everyone doing in the same thing, that's not going to benefit. So I want you to listen carefully, and at the end of this video, I want each and every one of you to be a leader when there is a situation. I want you to take charge. Hi friends, I am Dr. Ann, an anesthetist, and welcome to another dose of happiness and health. Today we are going to learn about cardiopulmonary resuscitation, CPR, and make sure that you stick till the end of the video, so that it will be useful both for you and also for the people around you, your friends, your family, so you can be equipped in case of emergency. So let's have a look at the video. So the first thing, if you see someone collapses, you send one person to call for help. You send one person to call for help if there's a hospital nearby, or you send someone to call the emergency number 108. So immediately send someone to call 108, so that by the time you are doing CPR, someone else will also be on the way. The ambulance will be on the way. 108 service is really good, and when you give a call to the 108 call center, then the call center will direct the ambulance nearest to you and they will come and pick the person up. So and they will take them to the nearest government hospital. The person whom you just found collapsed, don't worry that that's an unknown person. That's not a problem. If you send them on the 108, they will take them to the government hospital, and the police over there in the government hospital, they will help find who that person is and help contact the family. So it's always best that you call for 108 rather than calling for any other private ambulance services. So that's what you do first. Before you start doing anything, you send one person to call 108 or send a person to the nearest hospital. And then before starting CPR, you have to make sure that the person has collapsed. You don't want to give CPR to a person who's awake, so you tap them on the shoulder and ask them, hello, are you awake? Hello, are you awake? And if they do not respond, then you can start CPR. And by starting CPR, maybe they're lying down on their side, or maybe they're lying down with their face down. So you have to turn them so that they lie on their back, and the back, you can't lie them down on a cushion or a bed and all. They have to be on a hard surface, so that when you're giving CPR, the compressions will be effective. Now that the person is on the back, you check if they're breathing. You keep your ear near the person's mouth and listen and see if you can hear them breathing. If you can hear them breathing, they are alive and well, and you don't have to give them CPR. So just make sure that if they're breathing or not, and if they're not breathing, you can start CPR. So let's just assume that you're checking the person and you see that the person is breathing. So what are you going to do? But he's not awake. So what are you going to do? In such a case, when the person is breathing but he's still not awake, you don't have to give them CPR. You just put them in the recovery position and you wait for an ambulance to come, so that they will pick the person up and take them to the hospital. So now let's have a look at how to turn over the patient into the recovery position. If a person is unconscious but is breathing and there's no other life-threatening conditions, they should be placed in the recovery position. With the person lying on their back, kneel on the floor at their side. Place the arm nearest you at a right angle to the body with a hand upwards towards their head. Tuck their other hand under the side of their head so that the back of their hand is touching the cheek. Bend the knee farthest from you to a right angle. Now carefully roll the person onto the side by pulling on the bent knee. The top arm should be supporting the head, and the bottom arm will stop you rolling them too far. Open their airway by gently tilting their head back and lifting their chin. And check that nothing is blocking the airway. Finally, stay with the person and monitor their condition till help arrives. So the reason why we put a person in the recovery position is sometimes the tongue, it might fall back into the throat and they might not be able to breathe. The tongue itself might be choking, and sometimes if they're vomiting, if they're on their side, then they vomit outside. If they're lying on if they're lying on the back, then they will aspirate on. The vomiters will go inside the windpipe, and that will cause choking, and it will cause so much more complications. So that's why we make the person lie on their side. And so I hope you had a look at the video on how to put a person in the recovery position. In case you didn't pay too much attention, I advise that you go back. I put chapters in this video. There'll be, if you touch the timeline, you will see that there'll be this chapter, how to put a person in the recovery position, and you can have a look at it again so that you will know how to put a person in the recovery position. So now let's have a look at how to actually do the CPR. So you see a person who is unconscious and you check if they're breathing or not. They're not breathing. So now you have to start the CPR. So you make them lie down on their back. So you've already done that. And it has to be a hard surface, because you can't give chest compressions when they're on a soft surface like on a bed or on a couch. So either on the floor or on the ground, and you're starting chest compressions. And you've already called for help. You call for 108 and the ambulance is on the way. So till the ambulance arrives and help arrives, you are going to keep the person alive. You are going to keep their blood pumping. So get ready, and now we're going to do it. You place the heel of their hand in the middle of their chest. In the middle of their chest, there's a bone called sternum over there. You don't want to press on the stomach, because there are no bones over there. Even if you press it, the heart won't be pressed. So if you press on the sternum over here, the heart, which is under, will be pressed. So you have to give your compressions on the chest, in the middle of the chest, and with the heel of your hand. You're going to press with the heel of your hand. You keep the heel of the hand in the middle of the person's chest, and your other hand, you're going to clasp the other hand, and you're going to press with both the hands. And then before you start compressing, your elbows should be straight. So you're not going to be pressing this person like this. This is not how you press. The movement is not coming from the elbow. You're not going to be moving your elbows. We want your elbows to be straight, and you should be pressing down with your weight. You are kneeling down and you are going to be pressing with the weight of your whole body, so that you won't be tired. So you are going to be rocking up and down with the whole of your weight. So that is how we start chest compressions. In a minute, you have to give 100 to 120 chest compressions and 2 rescue breaths. So coming to rescue breaths, if you have been trained to give rescue breaths, you can give rescue breaths, but otherwise we don't recommend general public to give rescue breaths. You can do the hands on the CPR. That is, you give only the chest compressions. But if you have been trained to do CPR, we advise that you should give rescue breaths as well. And coming to CPR for kids, if you use both your hands, the ribs will be broken. So in kids, you use only one hand and you give chest compressions, but all the other mechanics are the same. You keep your elbow straight and you do the CPR. And in case it's a little baby, you give CPR with 2 fingers, because the ribs are very pliable. But anyway, the depth to which the chest should be compressing, you have to it should be 1/3 of the circumference of the circumference of the chest. So, and I forgot to mention another thing. So when you are starting for CPR, I'm sure you're in the middle of the street, someone collapses and there's a lot of people around you. So you are going to start the CPR. But before you start the CPR, you are a leader. So you have to remember that you are taking charge of the situation and you are going to decide what's going to happen. So you've sent one person to call 108 and you are going to start the CPR. But CPR, from practice, I have found that CPR is very tiring. So till the ambulance arrives, you can't be the only person giving CPR, minute after minute after minute, and the person's not waking up, and you're just going to give up doing CPR, and that's going to cause harm. So as you're giving CPR, you have to delegate another person who is going to take over instead of you, so that they will give CPR and you will take a break and catch up your breath. And then when that person is tired, you have another person give CPR, and then you take another turn. That's how you're going to be doing CPR, because the American Heart Association, it recommends that you give CPR at least for 20 minutes and try to revive them. So we don't want to just try for 1 minute or 2 minutes and then just give up. they might wake up. Yeah, their heart might start beating again. So we always have that possibility. That's why we're giving chest compressions, right? So when you are giving CPR, when you are getting ready to do CPR, maximum I think you can give CPR for 1 minute, but that's it. You become very tired. So have another person delegated, and so that the other person will take over and do the CPR and the other person. And before you do the CPR, you also have to practice at home so that you will be ready when such a situation arises. So practice having your elbow straight and the rocking motion. You have a pillow on the floor and check if you can do the rocking motion to see that if you know how to do the CPR, if you're getting your technique right. And also you have to know how fast you have to do the CPR. You're not going to puff. That's not how you do CPR, like that's too slow. That's not going to benefit. We have to give CPR in the rate of 100 to 120 beats per minute. So you have to know the rhythm in which you have to do CPR as well. It's like 2 compressions each minute. So you have to know how fast you have to do the CPR. So you have to get yourself trained to give CPR like that also. You have to practice at home with a pillow. You have to practice your position, how you're going to do CPR, and you also have to practice the rhythm, how fast you're going to do CPR. Like, this is quite fast, right? You wouldn't have expected that that's how fast that you should be giving your CPR, because you're giving 2 chest compressions each second, right? There's 60 seconds and in each minute, and you are supposed to give 100 to 120 compressions each minute. So this is how fast that you will be giving your chest compressions. So you have to practice the rhythm also with your pillows. I'm starting to look ridiculous, but that is how you practice. I'm sure if you're gonna practice, it'll be really useful for someone around you. So maybe your family, when you're at home, someone collapses, and by the time the ambulance arrives, then because you've been giving CPR, the brain will be having oxygen supply, the brain will be circulating, because it takes only 8 minutes for the brain to die when circulation stops. So just in case the heart is going to start beating again, if you have not been giving CPR for 8 minutes, then the brain would have been dead and they would have a stroke or they would have some disability. So you have to learn. So each and every one of us, it's our duty to learn how to do the CPR. There are various courses available. Like if you see somewhere courses being available, like places where you work, they might have this training, ACLS, ATLS. You can go for any of the trainings. They teach about that. So that's all about it, about CPR. Make sure that you share it with your friends so that they also will know how to do the CPR. And I'm so glad that you stopped by my channel this week, and see you again in the next video next week. Bye.